Hi there, it's Patrick from Eleu Health. I'm one of the co-founders of Eleu Health. Eleu Health is a health and wellness-based channel. Our channel is all about educating people on the topics that they find important to them. So, not only do we talk about what we think is important, but we also look to you to guide us as to what you need information and education on, and we'll obviously try to do whatever we can. We try to get our subject matter experts from all across the globe. We try to get our subject matter experts from different fields. And today we've got with us Dr. Richard, who will talk to us about chronic fatigue syndrome, or CFS/ME as it's known. Richard, in the last video that you did for chronic fatigue syndrome, we got a bit of feedback from some of our subscribers as well as some of the organizations that we're working with. And they really wanted to know a little bit more about CFS. And I think that's probably something that is not as well known or as well discussed or communicated as we originally thought. So we thought we'd bring you back in once again, and maybe we can delve into it. We like to get into the details because these details are the difference between a little bit of knowledge and really in-depth knowledge, so that we can hopefully give you information that would help guide you to the next step in your journey to find out more about some of these diseases or some of these issues that we all are affected with. So, Richard, ready to kick off?
Go for it.
All right. Great. So, one of the first questions that we had our users ask was, what is chronic fatigue syndrome exactly? And I think there's another term for it as well.
Yeah, so chronic fatigue syndrome often gets called ME, which is myalgic encephalomyelitis.
You want to try that one more time for our users?
No.
Call it ME?
Let's just call it ME.
All right. I just have a question for you. What is it with the medical field and coming up with these crazy names? Couldn't you just keep it simple?
Well, they've all got derivatives, the reason why they're called what they are. But yeah, they're confusing. They're confusing for us.
Yeah.
And they change, of course, like as we get more knowledge on them. So then you get duplicate names and double names for things. So
all right. So we digressed. That didn't take long, but let's get back to it. So you were saying in terms of CFS/ME, it is a...
Well, I mean, it's probably an underdiagnosed disorder, which basically affects a great many people in the world. And it's very complex. It can be severely debilitating. And the understanding of it, I think, from both medical and medics themselves to patients and their families and things, it's very difficult because the understanding is limited at the moment, although it is improving. But basically, it's a disorder which the crux of it basically is severe chronic fatigue, which is unlike any fatigue that you've had before. And there are certain criteria to meet which kind of help along the way of the diagnosis.
So it's not just feeling tired for tired's sake?
No, because I think the way modern life is now, I think we could all turn around and say we're chronically fatigued, and that's a different thing. This is undeniably something that is a pathology going on. There's some sort of disease process which is causing this. It's a bit like when people say, oh, I've had the flu, but really they've had just a bad cold. Mm-hmm. If you have the proper influenza infection, basically you are ill, you are bedbound, you can hardly move, you know you've had the flu.
Right.
So it's along those lines where this fatigue is absolutely severe, like when you have the flu, but it continues on, even though it can sort of fluctuate. It is a chronic disorder, or a disorder that continues.
I already have so many questions, but I'll stick to the ones that were asked by our subscribers and our users. Who does it affect? Does it affect a certain age group, certain sex?
Well, it can affect anyone, but the majority of people that are affected, unfortunately, are females, which they are researching as to why. But basically, it comes in females about 3 times as often as in males. The age groups wise, it often affects the early teens up to your 20s, and then goes up into the 30s and 40s is the real areas where it's more likely to happen. So these are the people it's going to happen to.
Okay, and we'll get into the severity of it, but it can be anything from, if you've got CFS, you can struggle to get to work, to you're homebound. Does that make sense?
Yeah, I mean, the very mildest form, you can almost feel like a lot of us do feel most days, where the modern day life is hectic and you feel tired, but you can function more or less, to the really severe, the very severe category where you literally can be bedbound for weeks and really affect everything from your mental health, your life, your finances, all of everything, holding down a job.
Yeah, there's a lot to get into today.
Yeah.
And actually, for our viewers, what we'll do is we'll make sure that we'll break up this podcast into chapters, and that way people can get to some of the topics if they want to skip over. I think maybe the first time around, just watch and listen, and we'll try to make it as engaging as possible. And then after that, if you just want to get more information, just skip to the chapter that you need. So let's jump to actually the most common symptoms. So I'm told over here there's quite a few. The first one clearly is extreme fatigue. Anything that stands out in that?
So that extreme fatigue, to fit with certain criteria, it's got to be present for more than 6 months. So it's not something that's just happened over the last week. It's something that actually get the diagnosis, you need to have really had for 6 months. Now, obviously, if you're getting 3 to 4 months and it's still the same, you're probably looking at that diagnosis, but along the way, your healthcare practitioner will be obviously ruling out any other things that you need to rule out. But that's the main point with that.
Yeah.
And then there's two other sort of major ones that fit. They're almost pathognomonic. That means basically it goes with this diagnosis almost exclusively. But that is post-exertional malaise, PEM. And this is basically when...
So I heard about PEM. I didn't know that it meant post-exertional malaise.
Yeah.
So, okay. So define that.
So it's basically when you have any form of exertion. Now that can be physical, it can be mental exertion. You end up with a period then of, again, severe tiredness, a kind of upping of the level of tiredness associated with doing those things. And it depends on... Everyone's different to what triggers them, but as I say, like just walking up the stairs might be an exertion too far for someone who's suffering severely, and it can put them back a week, and they can basically not be able to move very much for a week.
I have a question, and this is probably my ignorance more than anything, but I guess my big time solution to a lot of problems that I come across for myself, at least, is I can kind of sort of fix it if I take my supplements, I work out, and I sleep well. Doesn't sound like that those are necessarily solutions for people suffering from CFS. Or perhaps it's a solution that they can't actually do because of the severity of it.
Partly, a bit of both, really. One of the reasons is that, which we'll get on to in a bit, but there is no cure for it. There is no, here's a medicine, this is going to solve the problem. But the other thing is that all of those things you've mentioned can help in certain circumstances. Certainly, having a good diet, sometimes supplementation, and making sure you're sleeping well can all help sufferers. But it's not going to cure them. It's not going to suddenly change their diagnosis and turn it around. There's many other factors that need to come in to do that.
Okay.
So as you said, those things, the only one really, exercise is difficult for someone who's suffering from chronic fatigue syndrome because it can actually trigger you off. So that needs to be individualized as to what exercise and what movement is possible. And everyone's going to be different.
Any other symptoms that you can think of?
So the other one that fits very closely to it is orthostatic intolerance. And this is basically a term used for severe dizziness, if you like, vertigo type symptoms, often on the movements of from sitting to standing, from lying to sitting, from lying to standing. Basically, it affects your balance and can really be a debilitating problem. It can feel like you're on a ship or a boat that's at sea, or the room is severely spinning. At the mildest of movements, some people get it just sitting still, which you can't even stop that, So it can be really difficult to...
It's a hell.
Yeah.
I mean, From what you're telling me, it's a hell. And like I said, I've heard about a few cases of it, but we are talking about the whole wide range here. It could really be difficult. And then I also heard that there's muscle and joint pain, which I guess is the whole point of what we were talking about in terms of exercise.
Yeah, because muscle and joint pain can be helped by exercise in a lot of different disorders with which have that as a symptom, but often with chronic fatigue syndrome, it doesn't help. It can make things worse. But again, it needs to be graded, individualized. Those first three are almost have to be there in order to get a diagnosis. Most of the main criteria that people use will be there. The muscle and joint pain comes into it, but it's a later one because obviously there's lots of disorders that can cause muscle and joint pain. The others that can be involved, which obviously fit with many other disorders as well, but they often are linked, is things like cognitive difficulties. Now that can be related to your mental health, but it actually you can be in a reasonably good mental state and still have cognitive difficulties. And this is like brain fog, where you can't concentrate on something. You have severe problems making what's called executive decisions for yourself. Obviously, that can affect you holding down a job.
That doesn't bother me at all. I don't make executive decisions in my house at all. So
that's one for the wife.
Okay. All right. So the other ones are...
Well, the other ones, again, they can come... It's linked sometimes to what we'll go on to talk about the causes. So like severe sore throat can be a symptom, but it can be a continuing problem. It can predate the rest of the symptoms and then it can continue on. So sore throat, feeling like your glands are very swollen and painful in your neck area linked to that sore throat. And then other things like headaches can be migrainous type headaches where you cannot do anything. You need to just lie down with them, and they cause all sorts of things like nausea. The balance can also add to the nausea, but if you've ever had a migraine headache, nausea can be a big problem.
What about sleep? I heard sleep is something but I mean, that's almost a difficult one from my view, because with sleep, it can affect so many things, and it can be also the effect of so many things, like a sleep disturbance or not a good sleep. But is that one of those symptoms as well?
Well, I think sleep is affected. Good quality sleep is affected for a number of those symptoms. If you're in pain or you have a headache, sleep can be affected. But the point is that sleep disturbance often happens because you are whacked out all the time. You don't have those times of the day where you're working and you're energetic, and then you have the natural sleep cycle at night. Your sleep cycle is really messed up because you're often lying down all the time, and so you'll sleep and nap a bit when you can and then not. So it really affects, and sleep itself affects a lot of your hormonal balances and your cyclical hormone releases. So that's really where then sleeping becomes a problem on top of other causes like pain.
Okay.
Yeah.
Anything else from your experience that we could watch out for in terms of symptoms?
I think, again, they are not necessarily directly caused, but they can have an effect. So things like gastrointestinal upset, you can have constipation, or you can have diarrhea. Again, all of these can fit with other disease processes.
You're kind of building the picture as to why it's so difficult to actually diagnose it.
Yeah, because the list is pretty long. If you look at the list of possibilities, the list is pretty long. It also goes into many other issues as far as many other problems cause the same things. So things like GI upset and bowel upset, things like being very short of breath. They sometimes have problems with what's called air hunger, where you just feel like you cannot get your breath in. It's not necessarily rapid breathing, but it's just like you cannot get your air in. They call it air hunger. There can be other things like skin rashes can appear, being susceptible to infections, visual disturbances. Multiple things can.
That's crazy. All right. One of the other questions, so that was pretty detailed. So that gives us a lot more information. And frankly, for me, it just opens my eyes as to just what a debilitating type of disease this could be, and why there's so much misinformation out there as to what is the cause, what is the effect. So what we'll move on now to is the spectrum. So we know there's the mild, we know there's the very severe, everything in between, but maybe you could just lay it out for us a little bit so we know where we would stand. And why is that important?
Well, I think it is important, but it's only going to come with time and knowing your symptoms. And so it's useful in the diagnosis, but it's also useful in planning what you're going to need, what support you're going to need, what kind of level of medical input you'll need, what kind of things for your job, all those kind of things. And someone with mild could well hold down a job, which is great. It may be part-time, it may be not a physical job, but they may be able to contribute and to hold down a job. And so they just will have to be careful with their exertion going to and from work and their outside work activities, so they might have to reduce those.
Okay, so that's on the mild level.
Yeah.
And then what's the next stage?
So moderate will be more like you might have reduced mobility. So whether that's to do with pain, whether that's to do with actual fatigue of the muscles, so strength and energy in your muscles, so it can restrict you in even things like daily living activities, showering, washing your hair, cooking, all of those things might start to be affected when you start to get to moderate disease. And most people who are in the moderate category would not be working. They wouldn't be able to necessarily hold down a job because of the effects.
And then severe and very severe are sort of the next or the last two levels. What do they encompass exactly?
So severe is that you're virtually housebound. You're not going to be able to go out very much from the house, but you might still be able to move around the house. Whereas the very severe is normally you're almost bedbound for periods.
Wow.
Where you need round-the-clock care, you need someone to help you with even eating and feeding, obviously washing, things like that, and then household chores, obviously. So, and they can be really severe because a lot of it is hypersensitivity to exposure like sounds, light, all of that can really make people suffer. So all of that needs to be dimmed and tamed.
So we obviously don't wish anyone to ever have CFS, but if you do have it, what we're hoping is you're on the mildest of the mildest of the mild. Anything else is pretty rough. And even mild doesn't sound like a walk in the park. I guess it's just a walk in the park in comparison to being bedridden. But that's...
And I think they all of them are difficult to deal with because there's no...
Are you basically, imprisoned in your body?
Almost, yeah. I mean, yeah, partly. It's not the only...
It's making me uncomfortable. Like just, you're talking to me about it. I'm just getting so uncomfortable about it because I'm just thinking of all of the permutations of how people could end up being in dire straits.
Yeah. I think you can then see how it can affect you. Any of those, one of those categories, it can then have a knock-on effect on things like your mental health. Because if you are severely debilitated like that and you can't do what you used to, because it is a change. It's not like this has gone on for your life.
Yeah.
Suddenly this occurs, then obviously it has huge impact on your mental health.
Well, that's actually a very good segue now to talk about what are the causes of CFS. And before we depress our viewers more about this, I do know that there's actual research and there's progress going on in CFS. So what we're talking about here is to educate you and to provide you with some knowledge and some direction. But the reality is that things are evolving, right? So we will get to that. So hold with us. But again, the segue is what are some of the causes, because they seem to be far-reaching.
I mean, one of the difficulties, as I was going to say, about the actual levels and the severity of it is that there isn't physically, there's sometimes no way to look at someone and say, oh, you've got this or that. Okay.
Yeah.
So it's almost like a silent disorder, which is obviously affecting the patient severely. But the actual triggers for it, again, can be sometimes a bit of a mystery. And research has gained a lot of funding recently because of the COVID pandemic. And so...
Sorry, research in CFS has increased because of COVID?
Yeah.
Is COVID one of those triggers?
So one of the causes which they feel and they think leads to CFS and ME is infections, often viral infections. So many cases have been preempted by someone having something like Epstein-Barr virus or glandular fever or mono, as you might know it. And so many cases...
Also known as the kissing disease, if I may say so.
It is indeed.
Yeah, that's how I made myself feel better about that when I got it when I was young. But anyway, we digress once again.
So basically, because of that reason, it obviously looked like it was some link to that infection, whether that was a direct causation or was it to do with the immune system's reaction to that infection. And what they've seen is what you've all heard of long COVID, which is a sort of prolonged illness after having a COVID infection. Mm-hmm. There are so many links and so many crossovers with chronic fatigue syndrome that long COVID could itself be termed a form of chronic fatigue syndrome. And so this is why, as research in many things like vaccinations and things, money and research funding has gone up, it has shone a light on chronic fatigue syndrome and ME because of long COVID. So we're seeing an increase in interest in it. And that's good for the sufferers because obviously before, when we were talking about all the symptoms and everything, it's doom and gloom.
Sure.
But as with everything, science marches on, but it needs the backing and funding and the will. And I think that is improving and increasing, which is great news.
Until we get to the days of Star Trek where we do science for science's sake and there's no actual need for funding. But anyway, okay. So anything else in terms of causes?
Yeah, so that's the biggie. That's the one which kind of knocks on to the second one, which is immune dysfunction. Because again,
absolutely. They're kind of correlated, right?
Yeah, of course. You have an immune reaction to a virus or an infection that can grossly alter your body's immune system to the fact that it might attack itself, like an autoimmune disorder or other forms of modulation of the immune system. And so things like people who have CFS they can be more susceptible to other infections because their immune system is suppressed afterwards. And that's been shown and proven that on blood tests and following people with chronic fatigue syndrome and ME that they have less capacity to fight other disorders. So that immunocompromised people often is the term used, and that could be a term used for chronic fatigue syndrome sufferers.
Okay.
Yeah.
Any other causes that are out there?
Well, we mentioned before the main people who are affected, and that was females.
Sure.
And the reason that they're looking into for that is linked to hormones, and obviously the female hormones and imbalances in those hormones.
Okay.
There are also looking at, we all have levels of male and female hormones, whether you're male and female or not. But there's also other hormones like your stress reaction hormones like cortisol levels. A lot of sufferers have been shown to have very low cortisol levels. And now whether before they got it, they had very high cortisol levels, which would indicate very high stress levels on the body, maybe fighting an infection, it could be linked to that. Or there could be other reasons for it. Stress in your life, other stresses could then cause hormone imbalance.
It's funny because we were talking about this off air, where we said the research is really good around what happens once you're sick. But we don't really know too much about your wellness state, right? Once if you're okay before. So we don't know, we know cortisol levels are low and that could be one of the causes, but we don't have enough research to know whether or not people whether the cortisol levels were normal or low before they got CFS. And it's one of those things where if we could just track and monitor ourselves, that would shed a lot more light on the before, during, and after. Because the problem that we have is we know the after quite well, but the before and during seems to be a lot murkier.
Yes, so as with most disease processes, unfortunately, the precursors to it are not as readily understood. There are some things which have heavy funding and are able to do retrospectively. They can look at predisposing factors, let's say certain cancers. You can look at diet of someone, you can look at multiple lifestyle factors that might start to show increases in the prevalence. But when it comes to ME, it's very difficult because it strikes at random. It's not like
right. So who are you going to test?
Target, yeah.
Who are you going to target for research?
But overall, and as we've discussed many times, for all disease process, for all health and wellness issues, really, if you can track your norm and your healthy state and the precursors as much as possible beforehand, then obviously you're going to have much more data and much more information to give any researchers, any people when you do succumb to something. So the only thing that they've looked into at the moment, obviously they have a slight link with females, so they could target more females, let's say, healthy females, and start doing studies to see which ones suffer. But there's also work going on with genetics. And obviously that's happening in a lot of areas as well with things like cancer and stuff. But with chronic fatigue syndrome, there does seem to be a genetic predisposition. Yeah. So with that in mind, that's also something which they feel has a big impact to how someone manages. Again, it could be a genetic predisposition into how you cope with an infection, how your body deals with an infection, how the immune response is within a certain infection and the aftermath, rather than you just being genetically predisposed.
Yeah. So that's a long list of causes. We will actually itemize them and put them in the description, but it is a long list. And I guess that really brings us to, so how do you diagnose this? It just seems to be a cesspool of symptoms that could be anything. So I guess that's the challenge, right? That we were talking about off air.
Yeah, it's a really tough problem. It's a tough problem for all involved, and including the physicians, because not only as far as education, but also teasing out exactly what's going on with a patient, because it's very complicated, very complex. There's no one lab test that you can run and say, you have chronic fatigue or ME.
Right.
It's a case of, unfortunately, ruling out any other disorders that we do have tests for, whether that be things like hormonal imbalances, like hypo or hyperthyroidism, those kind of factors which we can measure, along with a whole gambit of other tests. That's just one. But to basically rule those out and start to look at how we can give you a diagnosis. Now, you've got those criteria to meet as well with the symptomology. So that 6 months of the severe chronic fatigue, which can be fluctuating within that 6 months, but it's not stopped. It's continued on for at least 6 months. The post-exertional malaise. So these are the tick boxes that you get. Yeah. And so what a doctor really will do when you go to them, whether you go to them and say, I think I've got this from watching a video like this, or if you just go to them with these symptoms, what they should do is obviously do a full assessment, make sure they look at your full medical history, do a full examination on you as well, and then do some pertinent lab tests to rule out these things. And then really using the established criteria, you would end up with a diagnosis.
So diagnosis is difficult, but it is possible to diagnose people. Is that? I mean, with CFS, with chronic fatigue, what seemed to happen prior, and when I say prior, I think that's an open-ended timeline, was that people had no sympathy for people who had CFS because they thought it was not really a problem. It was just, well, you know what, like we were talking about earlier, where it's like, well, my solution to a problem is kind of shake it off and go to the gym, eat better, take your supplements, the Hulk Hogan view of life, right? Do your prayers, your supplements, your exercises. But there's a lot of misunderstanding. And I think people with CFS seem to be targeted is a tough word, but misunderstood.
Yeah, misunderstood is one term to put it. I think also stigmatized in some respect.
That's a much better word, stigmatized, absolutely.
Because they have no real physical, anything to actually grab hold of as far as a physical test. As I said, there's no test for it. So really what it is putting this whole collection of symptoms and negative test findings for any other disorders, and then coming up with...
process of elimination, effectively.
It is, yeah, which is difficult for people to accept. And then it's difficult also to understand as a layperson or as a medic, because there are so few people who actually sort of delve into it. In some respects, it's a little bit like things like ADD. The disorders that you cannot see, you cannot physically have a lab test for, but could be underlying in someone's health and wellness and causing all sorts of chaos and problems. And so chronic fatigue syndrome, often they used to be called just lazy. They used to be called, it's all psychological and mental, almost like they're having a mental breakdown. And sometimes it can lead to that. But it was
sure, but it's no help if you start off by getting that thrown at you.
Yeah. We were literally written off. Majority of doctors would just sign you off and send you to psychology and psychiatry without actually seeing it as a physical problem. And still there's a lot of skeptics out there when you look at things like myalgia, which is another problem, which is something that doesn't have a litmus test. It doesn't have a specific lab test or imaging finding that you can say this is the problem. So you've got all sorts of...
We'll leave that to another video.
Yeah. But it kind of fits in that category of disorders, and they are kind of invisible to most people who are looking from the outside.
So how do you find your way forward? So clearly there's no cure. I don't think we're saying anything over here that there's no cure yet.
We have strong hope for the future.
Absolutely. But for today, clearly there's no cure, but there are ways to manage and treat it.
Yeah.
So how do you find your way forward if you've got a CFS-ME, wherever you are along that spectrum?
So, I mean, first of all, you need to find a practitioner who knows enough about CSF, whether that be a family doctor, whether that be a specialist in immunology, who often will deal with these things. Basically, someone who's going to not just fob you off, someone who's going to listen to and do the right things.
Not call you a hypochondriac actively.
Yeah, and not just write you off and send you to psychiatry, that kind of doctor. You need to be listened to and understood so that you can start to then formulate a plan of how to help. Because although there's no actual cure, as we said yet, there are ways to help you minimize symptoms. And there are all sorts of things that can be done to improve the situation. And when you have this disorder, it doesn't mean that you will never get better. You might never get 100% better, but it doesn't mean that you're never going to improve. Yeah. And so it's not a never-ending thing.
And you know very well at Eleu what we say, what can be measured can be improved. So the point is finding a way to get measured on this. This is the first step in terms of finding the resources that you need.
Well, the physician that you hopefully meet with and does all the right things, as I said, ruling out any other possibilities, but also accepting that this could well be the diagnosis and is looking forward and basically doing an assessment on your needs. So how to best support you, whether that's helping you with letters for work so that you can have help with things at work, whether it's reduction in your level of work or hours of work, obviously.
And that can also lead to long-term disability. There's a lot of things that a doctor has to check off in terms of documentation to get you into the right system.
And then you've got...
At this point, I will just remind everybody that this podcast is for general information purposes. It is not meant to be a diagnosis, nor is it meant to be a consultation. And if you've got any concerns or any issues around this topic, please do go see your doctor. What we aim to do over here is simply to educate and to inform and hopefully to provide you with a little bit more knowledge around these types of experiences. Sorry. So sure. Let's keep going.
No. So part of that assessment also is if your mobility is affected, you might need to have disability permits and things for parking. It may mean that you need to have some home adaptions for helping you around the home so that you can continue to try and remain autonomous and helping yourself. In the most severe cases, that can be really problematic. And also accessing funding, accessing disability allowances, accessing carers coming in if it's necessary. As I said, the most severe cases, it can be that you need 24-hour care. And this can be difficult to get because, as I said, there's no litmus test to say this is the reason they need it.
This is it, yeah. One of the things that we talk about at Eleu, and I think it really does resonate here, is our view is whether it's from CFS or any other type of disease, malaise, or mental or physical type of issue that you come across, it's really about plan, action, and follow-up. And for us, once you know what's going on, you need to build your plan, implement that plan, which is the action, and then do those follow-ups so that you can see what's working in your action, what's not working in your action, so that you can tweak it. There is absolutely nothing that works perfectly the first time around. But the whole point is that as you gather that information, as you gather your data points, you're able to tweak and improve. And you have to take, unfortunately, you'll have to be the leader of your own tribe here as you're looking for solutions. And yes, it's important to get support from the doctor, but I think this is one of those fuzzy areas where we almost have to inform the doctor a lot more than they'll be informing us, at least in the beginning. And that plan can definitely be with your doctor, right? But the point is plan, action, follow-up should help you at least have a strategy in place.
Yeah, and that really links into the other part of the support network is education, because educating yourself, but also educating your family members, your friends, and also your bosses and work colleagues. And I think this is support that is definitely needed in order to help you through this time. And that can be difficult sometimes to get people on board. So having a physician who will invite, if you want, a family member to come and to discuss it and to basically give some education using other resources where you can, whether it be seminars, whether it be podcasts like this.
Sure.
Get educated. So yeah, there is a lot of onus on the patient themselves, and sometimes that's the hardest part because they can be in a position where they really cannot do much of this kind of stuff. You know what I mean?
Stuck in that circular world.
I mean, I know everything is electronic and we can do our own research at home, but it's really having even the light from an iPad or something could be affecting you and causing you problems.
Well, there's that, and there's also when you do research, can sometimes go down the rabbit hole, go down to doom scrolling, and only to find out that you've got someone who's telling you, take this supplement, to take this pill, and you'll feel all better. And that's not really what's out there.
Scientifically
scientifically backed.
Yeah.
And speaking of that, one of the things that we've been talking about is pacing and as a technique to help. Can you kind of delve into that a little bit?
So pacing really is to do with things with your chronic fatigue and to do with your post-exertional malaise. So therapists who deal with you, occupational therapists is another person who may be called upon to help sufferers. They work on things called pacing. And this basically means setting, it's going to be very individualized, but setting your limits and not overexerting yourself. So whether that is doing one flight of stairs a day is your maximum, because you can very quickly overexert yourself and end up putting yourself back by days or weeks in your symptoms and having that PEM episode where you can be absolutely wiped out. So really it's about discussion with these types of therapists to work on what's best and how to do your pacing.
The whole point, I think, for pacing here is, again, kind of contrary to how we really think about things, because we usually think about things in terms of push yourself, right? And if you push, you're going to make sure that the next barrier is broken. But over here, if you push yourself, it sets you back. So then it may take you a while to get back to your initial barrier.
Yeah.
So
I think in most health-related cases, exercising, not pushing yourself over the limit still, but your limits are going to be a lot higher. Whereas with chronic fatigue syndrome, your limits can be extremely low to the point that you just wouldn't be able to believe that you're going to end up with severe fatigue from a very minor exertion.
Right.
And sometimes, unfortunately, the only way you learn that is through experiencing it. But as I say, these skilled therapists will go through it with you and help you in that pacing structure.
So that's really in terms of the managing of it. That seems to be like a big part of it. Are there any treatments, like actual, whether it's pills or medications? And I know we're not going to talk about specific medications, but are there medications out there that can help?
So there are medications to help with the symptoms that go alongside it. As we said, there's no one cure or pill that's going to make everything miraculously go away. But things to do with if you have severe sleep dysfunction, sometimes having pharmacological type interventions for sleep can help. But again, it's all about making sure it's managed under supervision and correctly, not self-managed, and you could make yourself worse, in other words. Obviously, I've mentioned quite a few times that mental health can be impacted massively. Sure. And obviously...
like anything in life, if we're being honest.
Yeah. Severe disease has an effect on people's mental health for sure. And so having therapy for that, having possibly pharmacological therapies for that also can help to alleviate those knock-on comorbidities, should we say, knock-on effects of the disease rather than the exact disease. And then if you're suffering with things like pain, obviously having certain painkillers might help, certain pain modulators, should we say.
But all of this with like absolute doctor intervention, medical intervention,
yeah, sure. This is
guidance and
it's not something you should be doing alone.
That's really the part that's very, very important here.
And then alongside the pharmacological therapies, there's obviously the non-pharmacological. So things like if you're suffering from orthostatic hypotension and intolerance, where having a good salt intake can be the opposite to what most practitioners will say is good for your health, but you might need a certain amount in order to mitigate some of those.
That's that hypotension state, right?
Well,
so low blood pressure as opposed to high blood pressure.
Yeah. And it can link basically to that intolerance, what they call orthostatic intolerance.
Okay.
So where you're having that vertigo imbalance. It mainly helps people who are having it when they're standing up from lying and sitting.
Anything else in terms of managing CFS or treatments around CFS specifically?
Again, depending on your symptoms, but things like if you are intolerant to too much stimuli, whether that be visual, sound, sometimes you might find that people need to wear sunglasses and things to shade their eyes, people who want to avoid noise, and this can be what you or I might say is insignificant noise, but can be a real shrilling noise in the ears of someone with chronic fatigue. They may need to have noise-cancelling headphones or something like that to give them some peace from those things. But these are all things that can be looked at.
Sure. I mean, they may have been created to solve another issue, but if they're solving this issue, things in life are multi-purpose.
Utilize what we've got, the technologies we've got, the equipments that we have in order to help. Yeah, for sure.
So what are the long-term effects of CFS-ME? And I understand that there's a ripple effect, but what do they encompass exactly, and what should we start to look out for as we try to manage this disease?
So because it can really affect someone's job and income, you're looking at things like financial stresses, and obviously career progression can be halted and sometimes in some cases ended. So you have all of that pressure that then has a ripple effect on you, your family. You may have spouse, kids, all needing the financial input that you were producing, and suddenly that's taken away. So that's a huge ripple effect. Not only with that, you then have, because of your financial obligations, you may then have a knock-on effect on other health issues. So you may not be able to afford to eat healthily. You may not be able to afford to heat your home or cool your home, depending where you're living. So again, it has a knock-on effect on multiple issues. One of the big ones is the effect on relationships. Because of this invisibleness to it and not having a litmus test and lack of understanding in people, your relationships, social life, whether it be your marriages, whether it be your friendships, they can all be strained by this.
Absolutely. You could lose a lot. You can lose a lot.
And this is something that needs to be planned and helped at the diagnosis stage,
Sure.
and maybe even before that, but to be thinking about all of these long-term ripples that someone's going to have. Again, mental health, long-term wise, can be massively impacted. So that's something
Mental health and emotional well-being is not just something that we think of in the abstract anymore, right? This is something that we're very clear on after COVID as well, that it has an effect on us. Just because I'm not bleeding on the outside, it doesn't mean I'm not hurting on the inside. And those two, they're looked at differently, but they do have the same consequences. And so we're big proponents of mental well-being at Eleu. And I think that this is probably one of those things where, especially for CFS, you do need to get support, because there's no way that you should be suffering in silence alone. You should try to communicate and try to get as much support and as much help as possible. It's just going to be that much easier for you in what is a very, very difficult situation.
Sure.
So now, we talked about this earlier. A couple of things. First of all, the research in terms of things are improving. Are you seeing things that are starting to come out that would be helpful for us within the next half decade, or is this just one of those things that's just rippling out slowly, and we're getting more and more information so that there is hope? Like you said, there's no cure yet. There are ways to manage it. There are ways to treat it as much as you can. But are you seeing the research? You're seeing a better flow of research now. Promising?
I think so. I think, again, the COVID knock-on effect,
Yep.
people, governments, the powers that be who have the financial backing can see these things as a huge problem. And it's likely they're only going to get more prevalent, not just CFS, but disease processes such as pandemic infections and things could occur. So they've got to be ready for it. I think that was the biggest mistake of COVID.
Many mistakes, but that's for a different day and different channel.
So I think research is definitely improving, and there's a lot more going on regarding this, and directly as chronic fatigue syndrome, stroke ME. But as I said, long COVID could almost be a form of chronic fatigue syndrome. So if research is going ahead in COVID, it's going ahead in CFS.
Right.
And so, yes, there's definitely more and more. And also, as things are increasing in other areas, not a knock-on effect as well, like with genetics, we are going to find more links to disease processes. So as we get more knowledge and research.
Keep your faith and keep your hope.
Yeah, no, absolutely.
Right.
Yeah, I think, you've got to. It can be very hard. I will definitely appreciate that. But if it's managed properly and you get a good physician who's going to back you and plan with you, then this is number one to having.
Well, and that's another good segue. So what are some of the self-care tips that you can give to sufferers of CFS?
So we spoke about pacing yourself. That's one of the biggies, because you really don't want to be overexerting yourself. So it's finding your limits, breaking down your activities into smaller chunks so you're not doing all at once, and make sure you prioritize your rest.
Mm-hmm.
That's activity should be a quarter of the rest time, that kind of thing. Again, these are plans that you can plan out with your therapist. Make sure you listen to your body well, pay attention to it. Don't ignore signs, symptoms, issues, because they could snowball and become an issue. Alongside that, make sure you're not ignoring other parts of your health that can go along with it, because other disease processes can be happening to us all the time. So make sure you're not purely concentrating on this and ignoring all of your other health bits. Sleep is a difficult one. We spoke about it before. I think it's trying to, what they call, have good sleep hygiene. If you were laid up in bed all day, you would find yourself zoning out, falling asleep. And I think it's trying to keep yourself awake, trying to keep your mind awake, so that you can almost have the same sleep cycle as if you were normally functioning. where you sleep during the night and you're awake during the day. So try and create a sleep conducive environment at those right times. And when you don't want to be asleep, if you can tolerate it, obviously having things that are going to stimulate you but not overstimulate you, if you get my point, where you're not going to feel too sleepy. Again, it's a very fine line. It's very difficult to judge that. Everyone's going to be different. Another really important thing to do, we spoke about a physician, but you're not alone in this. There are millions of sufferers around the world, and there are lots of groups, online groups, people who you can connect with, share your experiences, because that can be a really big therapeutic help, helping your mental state, helping the fact that you realize you are not alone in the problem. And ideas and conversation can be generated from that, which may well lead to improvements for yourself. So connecting with people is really important. Don't isolate yourself and shut down. And finally, things like doing gentle exercise that's up to your limits. It can be important. Things like yoga or very short walks, things like that. Low impact would be advised, again, depending on your individual state. But it's still important to look at doing some form of exercise.
All right. Fantastic. So this was a very, very informative, but really what a tough subject to tackle. I have to say, like our prior ones, whether it's around pediatrics or the upcoming ones around healthy aging, blood pressure, stress, there was always a way that we could find a place of equilibrium. Mm-hmm. And with CFS, I'm not saying you can't find that equilibrium, but the challenge is in the whole journey, right? Not in at the beginning or the during or the after. As we were saying before, create your plan. After you create your plan, implement it. So that's the action. And then from there, it's the follow-up so that you are able to measure how things are going. And that should help you because what can be measured can be improved. And then finally, I will repeat again, today's podcast, thank you first of all, Richard, is for general information purposes only. It is not meant to be a diagnosis or consultation. And if you do feel that you are a sufferer of this disease, please do go seek medical attention through your doctor or a medical professional. And in the meantime, we'll see you in the next video and take care.